Good afternoon, everybody. My name is Chloe Wheatman. Myself and Leah are leading this session. Leah is not here. She is online. So she's doing this exact same session online to all our online delegates. Okay, let's get started. So I'm from the University of Salford. I'm one of the lecturers here. And we have been recently working on enhancing our communication skills for our learners. So here we go. Simulation-based education is a training technique used in healthcare education for over 100 years. We use simulation to guide our learners through scenarios, and often these scenarios have either never been experienced before or something that is complex and requires practice. Now, simulation is immersive, so that learners feel as though they are really there. It's interactive, and it allows our learners to participate in complex, real-world scenarios and practice in a safe environment. During simulation, facilitators are present, and they help prompt and guide learning. You're going to see quite a few facilitators today. They're going to work the room whilst we do this kind of workshop and networking session, and they're going to help with those discussions if needed. There is a structured simulation-based education, and this includes a pre-brief, the scenario itself, and a debrief will follow. Now, the debrief is really the time that it allows our learners time and space to reflect on their experiences and develop any action plans for future learning or, again, for future placements and clinical practice. Now, today you're going to experience some video-based simulation. This is related to advanced communication skills. We're going to follow with a debrief, where we're going to reflect on the scenarios. At this point, I'd really like you all to join in, discuss with each other on your tables about your thoughts and reflections on the scenarios. We will then use a Padlet to share that with each other. The Padlet will be online, and I'll ask you to use your phones to get a QR code and to put all your ideas on. There's nothing to worry about. This is a safe space. The scenarios aren't complicated, but they are situations that have been simulated that you may have already experienced or may come across in your future practice. Okay, let's move on to the first stage, which is the pre-brief. Okay, so today in our session, we're going to look at some video-based simulation scenarios. We're going to share these experiences with each other and see if you've had any simulation experiences before. And I know some of you in the room have done simulation within your physiotherapy curriculum. And then we're going to reflect on it together and see how it might help prepare you for your placements. So this is the pre-briefing, okay, the first stage. So the following videos are examples of two scenarios. These are scenarios that we've used this last 12 months in our teaching and learning in the physiotherapy curriculum. The people in the video are played by simulated people. Okay, so you might, as you see your facilitators walking around the room, you might recognize some of the actors and actresses in the videos. Pete, the physiotherapy learner, is actually one of our learners at Salford. He's a first-year physiotherapy learner. He's just gone into his second year now. So these are real scenarios that we do in our teaching. While we're watching the videos, so again, we're going to watch some videos, really reflect on your communication, okay? How Pete interacts with the patients or the other people in the videos. I don't want to spoil it for you. His professionalism, and then anything else from your perspective as a physiotherapy learner. Okay. Sorry. Okay, here's the first. So, just keep it paused one moment because I'm going to pre-brief you. So, you're now going to experience a video-based simulation. You will watch this video, but our learners actually experience this in real life, and each of the physiotherapy learners played the role of Pete. So here's the scenario. Let me set the scene. Alex is a 13-year-old. Alex's mum is his main carer, and he attends a specialist school for children with learning difficulties and other health needs. Alex communicates non-verbally, and he's learning Makaton signing in school. Alex understands most things that people say if their sentences are short and direct. It is the summer holidays. Alex's mum is having a routine procedure in the hospital. Usually, in the summer holidays, Alex and his mum take daily walks around the park for some fresh air. This also helps with Alex's anxiety. During this time, and for the first time, Alex is staying at a centre providing residential respite. Alex has never been separated from his mum overnight. Pete, who you will meet, is a student physiotherapist on placement working with children with learning difficulties. He has been asked by his educator to see Alex, to see if he could like to go for a walk, as he seems quite anxious. Let's see how Pete approaches this. I'm going to play this video, and then we'll move to a couple more, and I'll pre-brief you. So, we're going to play the video.
Hi, I'm Pete. I'm a student physiotherapist. Are you Alex? Yeah? Are you okay? Are you worried about your mum? Yeah? Can I help? Do you want to go home? Alex, you can go home tomorrow. Would you like to go for a walk with me? Yeah? Come on, let's go. It's a really nice day outside today.
Okay, take a minute to reflect on that scenario. Have you been in that situation before? Would you know what to do if you went to see a patient and you had never, who was nonverbal? Have a reflect. I'll give you a couple of minutes just to talk between yourselves. No, it's not yet. No. Okay. It's okay. We'll yeah, fine. It's
Didn't get a chance to tell you. I'm waving cards at you. So I thought I better explain why.
Okay, I'm going to bring you back to our videos. Just a short reflection there, and then we'll move on in a little moment to a larger group reflection where our facilitators will come round. But I'm already really excited because there's lots of chat happening already. So this is going to be a good debrief. Okay, this next scenario, I'm going to pre-brief you. This is Pete again. He's coming to the end of his 6-week community paediatric placement. He visits Jamie and his family at home with his educator. His educator is out of the camera shot of the video. Pete's educator is preparing to complete his first placement documentation, and he would like to observe Pete's communication skills. I'm sure this happens and has happened or will happen to many of you. Jamie has been recently diagnosed with hypermobility syndrome, and his parents at school have noticed that he is not himself. Let's watch this next video, and see how Pete handles this scenario.
I'm your student physiotherapist today. This is Amitav. He's going to be interpreting for me.
मेरा नाम अमिताभ है, पीट स्टूडेंट फिजियोथेरेपिस्ट, जेमी के लिए आया है.
And who do we have here? What are your names? Sorry.
आपके नाम बताइए.
என்னோட பேர் சுதன், ஜேமியோட அப்பா. இவங்க தீப்தி, ஜேமியோட அம்மா.
So Jamie's father Sudan and mom Deepti.
Yeah, lovely to meet you both. Lovely to meet you. So the reason I'm here today is because Jamie's recently been diagnosed with hypermobility in his joints. How's he getting on a day-to-day basis?
जेमी को अभी रिसेंटली हाइपरमोबिलिटी से डायग्नोस किया था, तो वो उसके बारे में पूछने आया है कि उसको अभी दिन ब दिन कैसा है वो.
ஜேமி நல்லா தான் இருந்தான். அப்பப்போ தோள்பட்டையில் வலி, முட்டியில் வலின்னு சொல்லுவான். அப்போ உடம்பு ஃபுல்லாக வலி இருக்குன்னு சொல்லிட்டு இருப்பான். ஒழுங்காக நடக்க முடியாமல் இருப்பான். வேற
और वो रात को सो नहीं पाता है, स्कूल जाना नहीं चाहता है, कुछ खाना पीना नहीं, कुछ
Body pains.
पूरा दिन वही बोलता रहता है.
And doesn't want to go to school.
Okay. I noticed there was quite a lot of dialogue from both parents there, and you said it was just body pains. Is that exactly what they said? Just so I'm getting all the information I need.
It's just what they said.
Yeah. Well, if you could repeat back exactly what they said, so I'm getting the full context, please.
Okay, so first he told about body pain, mostly on his arms and legs,
Okay.
and then mother told doesn't want to go to school,
Okay.
doesn't want to play, not eat as well. So that's it.
Yeah, that was everything. wasn't it?
Yeah.
Yeah. Well, thank you very much.
In this next clip, we'll see Pete continuing his conversation and assessment.
कंप्लेन करता है कि उसको ये नहीं हुआ जाता उन्हें, और वो बहुत दर्द होता है उसको बार बार. तुम यहाँ पे फोन पे क्यों हो? मैं यहाँ पे बोल रही हूँ, उसके बहुत कुछ प्रॉब्लम हो रहा है, तो तुझे समझ में क्यों नहीं आ रहा है? सब कुछ मैं ही क्यों करूँ?
So Jamie always complains that he's having pain and everything, and mom is like she has to do everything, and dad's quite busy in his work and everything. She also works, and they're not getting enough time with him. Yeah.
Okay. I can appreciate how hard that must be for you both. I know what it's like to juggle work life and home life, so it is challenging. I can see how much you care and want to get this right. Is there anything that I can do to help while I'm here?
वो यही बोल रहे कि समझ सकते हैं कि काम और बच्चे को संभालना इजी नहीं है वगैरह, तो वो इसीलिए पूछना है कि वो किस तरह से आप लोग को मदद कर सकते हैं क्या.
हाँ, जेमी को चलने में मुश्किल होता है, वो सही से चल नहीं पाता है, बार बार गिरता है, उसको बैलेंस में थोड़ा प्रॉब्लम होता है, तकलीफ होता है. तो
Okay, so he's having problems while walking. Okay. And when he's walking, suddenly he loses his balance and everything.
Okay, all right. Would you mind if I had a look at Jamie's balance now, if that's okay, please?
अगर वो चेक कर रहे हैं उसका बैलेंस, आपको कोई तकलीफ है उससे?
नहीं.
Alright.
Yeah.
Yeah. शुक्र है गुरु.
Hi, Jamie. Hi, what are you reading? The Dandy. Nice. Excellent. Would you like to try and play a bit of a game with me? Yeah? Do you think you'd be able to stand up on one leg? No? Are you sure? You don't want to? Okay, no worry. Who's this here? Captain America! Nice. Is he your favourite Avenger?
Yeah.
Yeah? Nice. Do you think you'd be able to copy all of the movements of Captain America?
Yeah.
You would? Wonderful. Would you be able to do this? Stand on one foot, like he's doing. Nice, excellent, well done. And if you put both feet down now? Oh, good work. Excellent, well done.
Okay, so those are our two scenarios. What I'd like you to do on your tables is I'd like you to discuss those scenarios. Think about if you've been in that situation before. Think about any challenges that Pete may have had in those, any challenging conversations. If you were in Pete's shoes, would you have done anything different? What skills did he use non-verbally throughout both of those videos? Okay, I'm going to give you 15 minutes to do that within your tables. You'll have facilitators coming round just to help with some prompts and conversations. Thank you. Okay, let's come back together. I am mightily impressed by how quickly you come back together. This doesn't happen with my first year physios at the moment. Lovely. Okay, so what you've experienced there is called a debrief. The debrief usually and should take much longer than the actual simulation activity itself. The debrief is the learning part of it. So what I wanted to do was to share some of your reflections with yourselves, and then let's have a quick talk about what we thought we might learn from that simulation, and how we might be able to use simulation moving forwards. I'm just waiting for it to come on the screen, but when I was walking around, thank you. So when I was walking around, there was a couple of reflections on Alex, and some from this middle table said to me, well, I don't know Makaton. Does anybody in the room know any Makaton signs? Hands up if you know. Yes, what? Okay, if you look around, that's 3 people, all right? So everybody is in the same boat. We don't know things. We don't have to know all these different non-verbal communication skills. But what could we do? You had 10 minutes before you went in to see Alex. You had 10 minutes. What could you do to prepare yourself in 10 minutes? Yes? Yes, just learn how to say hello and my name is. That's a good start. What else? Anything more? Yes?
If you really know the idea of what you're looking to do, so get them outside, go for a walk, you could just learn the basic verbal commands, which can be very easily simulated just as you go.
Exactly. So you know what your objective is. Let's go for a walk. Let's learn a couple of those signs to support that. Good. Anything else? Bingo. So you said we could print something off if the patient was able to read. Okay, good point, good point. Do you want to add to that? Exactly, print the signs out. Okay, print the Makaton signs out and point together. There's always a way to communicate.
I think you convince yourself that you're able to have an effective conversation with the patient, which I don't think is a good thing. So as much as you could learn a few signs, are you actually effectively going to treat that patient, understand what they need?
Exactly.
If you're going in there thinking enough signs is enough, I mean, why wouldn't you look for a translator? Why wouldn't you look for someone else who can actually get the information you need? Because otherwise you go there and, effectively lead the entire conversation, pat yourself on the back and go outside.
Exactly. So what's your name, sir? Matthew. Matthew made a really good point. So we could learn some signs, we could go in there and we think, right, we've got Alex out for a walk, and that thinks that we could be really effective in that communication, but actually, are we? Are we really getting the best out of that session? So what it's about is really reflecting on ourselves, our skills, and also pulling on others in the team, because Pete's on placement. Okay, surely there's other members of his team that can come and support Pete in this scenario. Thank you very much, Matthew. Appreciate that. So let's think about, let's move on to, let's have a look at some of these Padlets. That's what we wanted to do. So what we liked was that Pete was on the same eye level as Alex for communication. Pete was very clear, short sentences, you're right, if we could scroll down. He had learnt some hand signals beforehand. He knew he was going to go and visit Alex. Let's move on to Jamie. So we've got Jamie. This was a scenario I have been in many times. And this is where this came from, really. This scenario was my personal experiences, but also experiences of the wider physiotherapy team. So what we noted was when we had a big stakeholder event for the university a couple of summers ago, whilst we were re-evaluating our programme, and our clinical educators said that our learners really struggled with those non-technical skills. So they're great with clinical skills, but those non-technical skills like leadership, time management, communication, situational awareness, knowing about kind of hospital environments, etc. So this is why we developed these non-technical skill scenarios and specifically focused on the communication element. So when we looked at Jamie's scenario, Pete was showing empathy. Did we notice that? How was he able to show empathy? I feel like he was doing that in a couple of ways. Give me one of the ways that he was showing empathy. Yeah.
When the parents got upset, he noted and verbalized that they were upset, but that they were, he knew that, and just validated that they were there to help their kid.
Yeah.
And cared about the kid.
Yeah, so Pete validated that the parents were upset and it's okay to be upset. It's understanding that. What else did he do? Yeah, so he shared something about himself as well. He empathized. He shared that we all have these, difficulties in life. It's okay to feel like this is very normal, normalizing what they're experiencing. Anything else? Any other way? Okay. Yeah. Exactly. So he ensured that he built rapport with not just the parents, but the patient as well, the child as well, got down to their level, utilised Captain America. Matthew, what did you want to say? Go for it, Matthew, please.
For me, it's the way he came out. So he was saying about having, I struggle to have a work-home life balance, and he communicates that in a way. So the parents don't know him. They don't know what his life is like. What he presents as a young person who may not have a lot of complicated things going on at home. And what he's done is essentially just gone, oh yeah, I know what it's like because I've got this work-life balance. That's compared to you who have just recently been told your child has a long-term health condition. And I think, for me at least, I think it's quite inappropriate to bring your own personal stuff like that, but particularly in that way, into the consultation, because I think it's almost performative empathy. It's not actual empathy.
Okay. So Matthew feels that maybe it was more thank you, Ash. Maybe it was more performative empathy rather than actual empathy. Okay, because do we know, has Pete really, does he really understand? Has he got a child who's also been just diagnosed with a long-term health condition? So it's really good. This is what I'm wanting, okay? We shouldn't all agree because we've got all different thoughts, feelings, experiences, backgrounds.
We discussed that.
One moment, wait for Ash. Sorry.
We also discussed the same about him, it being a high-risk strategy, but then we said that actually we don't know Pete's situation, so he may know what it is like. And we said to overcome that, he could just maybe, if he felt comfortable, to explain a little bit beforehand
Okay.
about why he knew what it was like.
So a bit more context to it. So Matthew's right there. What's your name? Kerry. Kerry, again, good comment from Kerry. So, Ash, sorry, there's a little bit of a walk over there. And we'll make this our last sharing.
I just wanted to say, I agree with Matthew on that. I think he was trying to empathise, but it's not really validating the mum's and dad's feelings, and she was getting upset. And I think by just saying then instead of saying that sounds really hard and acknowledging the situation, it's just bringing in your own situation, which maybe is difficult, but I don't think that's appropriate in that clinical context.
Great. What's your name?
Rio.
Rio. So what would you do?
Maybe something like I just said, listen and then get the translator to say something like, that sounds really difficult. Do you want to explore that further? And maybe get to understand their situation a bit better instead of just comparing it to yours immediately, because you haven't fully understood their situation, particularly with the language barrier.
Precisely. Thank you very much. Thank you very much for everyone there. As you can see, that lots of people have different thoughts, feelings, experiences, and actually we've disagreed quite a bit here in this forum, and that's okay. That's what it's about within simulation and debriefing. It's about having a safe space to agree, disagree, to share experiences. Now, a couple of you have mentioned here that we think it would help develop soft skills. I'm really glad you said that, because this really is soft skills, which is more likely called more... I knew that was going to distract me, my little 1 minute. It's okay. All good. So the soft skills are also called non-technical skills. Okay, this includes leadership, time management, etc., etc. What I wanted to say today is that our main aim was to introduce you to simulation-based learning, make you aware that there's different ways of learning out there that can support you in clinical placement and clinical practice. I'm really open to you sharing this with your academic team back at the universities and encouraging them to get in contact with myself at Salford University. Let's see if we can move forwards with a different way of learning and simulating our environments. Thank you very much today. Much appreciated. Thank you.